Good morning, everyone. So, today we are going to discuss a topic called wound healing. So, what do you mean by wound healing and repair of wounds? So, whatever the cell injury happens, it has to be repaired. So, today we are going to discuss a topic called repair of wounds. So, So what do you mean by healing? So healing is nothing but it's a body response to any injury in order to restore its normal structural and functional activities. So healing is nothing but it's a response of our body in order to injury, in order to bring it back or in order to restore the normal structure and function as it is in the first before injury. So that process we call it as healing. Okay, it's a body response to in an attempt to restore normal structure and function, and it involves mainly two steps. It includes regeneration and repair. What do you mean by regeneration? So healing takes place by proliferation of parenchymal cells and usually result in complete restoration of the original tissue. Whatever the tissue that is damaged and removed, so the same kind of cells will be regenerated by proliferation of the parenchymal cells. That we call it as regeneration. And what do you mean by repair? Repair is nothing but it's a proliferation of connective tissue. Regeneration is nothing but proliferation of parenchymal cells, and repair is nothing but proliferation of connective tissue resulting in fibrosis and scarring. So here in this process, there will be formation of fibrous tissue and scar tissue in case of repair. So in case of regeneration, there will be only proliferation of the parenchymal cells, which helps in the redevelopment or restoration of the normal tissue. So that we call it as regeneration. And proliferation of connective tissue is called as repair. It involves the formation of fibrosis and scarring in case of repair. Sometimes both may take place simultaneously. So when coming to regeneration, so how does a replication or proliferation of parenchymal cells takes place? It takes place through cell cycle. It involves the following phases. So it includes M phase, that is mitotic phase, or phase of mitosis, G1 phase, that is gap 1 phase. During this phase, what will happen? The daughter cells enters the G1 phase after mitosis, and then S phase or synthesis phase. So during this phase, there will be synthesis of nuclear DNA. Nuclear DNA will be synthesized in case of S phase. And G2 phase, after completion of this nuclear DNA, the cell enters into G2 phase. So after the formation of nuclear DNA, it enters into G2 phase. And then G0 phase. So this we call it as resting phase after an M phase. So these are the phases which takes place in order to produce in the process of proliferation of parenchymal cells. So this we call it as cell cycle. So any cells, any parenchymal cells, its regeneration, it involves mainly two processes. First is proliferation of original cells from the margin of injury with migration to cover the gap. That means if this is the injury, the whatever the cells which are at the margins, that will undergo proliferation in order to cover the gap. Okay, and then proliferation of migrated cells with subsequent differentiation and maturation. So first it includes only proliferation and then it undergoes maturation. So when it undergoes maturation, then it will have some function. So that we call it as that will be the second phase. It involves differentiation and maturation so as to reconstitute the original tissue. So first, in first step only, it will undergo proliferation from the margins. It will enter and it will cover the gap which is formed during the wound. And then whatever the cells that undergone proliferation, they will differentiate and undergo maturation and will give the normal functioning or normal structure and function to the original tissue as of the original tissue. This is the cell cycle. This is the mitotic phase. So in the mitotic phase, these are the processes: prophase, metaphase, anaphase, and telophase. And G1 phase, S phase, G2 phase, and again, if this process doesn't take place, it leads to cell death. And this is the resting phase. So here there are labile cells and stable cells. So whatever the labile cells are there, that means only that kind of cells undergo proliferation. When coming to stable cells, they cannot undergo regeneration. Example is neurons. Whatever the neurons are there, they cannot undergo regeneration. So the remaining cells can undergo, whatever the cells that can undergo proliferation, that we call it as labile cells. So that is all about regeneration. And now here we have to mainly concentrate on repair of wounds. So repair of wounds is nothing but, here it undergoes, as we have seen in the definition, it is nothing but the proliferation of connective tissue. So it will be seen as a deposition of fibrous tissue and scarring. So it is nothing but replacement of injured tissue by fibrous tissue. So it involves two processes. The first process is granulation tissue formation and the other is contraction of wounds. So repair, it involves two steps, that is granulation tissue formation and contraction of wounds. And then repair response takes place by participation of mesenchymal cells like connective tissue stem cells, fibrocytes, endothelial cells. So in the process of repair, what are the cells are involved? That includes mesenchymal cells, that include connective tissue stem cells, fibrocytes and endothelial cells. And then macrophages and platelets and other parenchymal cells of the injured organ. So these are the cells that mainly involved in the process of repair of wounds. And then how does this, the first step is, as I said, granulation tissue formation. So what do you mean by granulation tissue? It will be like granular, slightly granular, and it has pink appearance of the tissue can be seen. So each granule proliferation of each granule contains whatever the things that contains in each granule. It contains newly proliferated small blood vessels or capillaries, which are slightly lifted by thin covering of fibroblasts and young collagen. So it has, in the granule, it has small newly proliferated blood vessels and newly formed fibroblasts and collagen. So these are the things that which will together forms this granulation tissue. So in the process of this granulation tissue formation, it includes three phases. So the first phase is phase of inflammation. So as we know that following a trauma or any injury or any blood clots at the site of injury, so initially whatever the thing that takes place is it will activate the inflammatory system and it will cause the acute inflammatory response. So when there is acute inflammatory response, what does it do? It will remove the with exudation of plasma. That means whatever the dead side tissues are there, that will be exudation into the spaces, interstitial spaces, so of plasma, neutrophils, monocytes within 24 hours. So this takes place within 24 hours. That is, first is phase of inflammation. So in this, whatever the inflammatory cells are there, that gets exudated out within 24 hours. And then phase of clearance. So when these inflammatory mediators are released, they will release certain proteolytic enzymes. So these proteolytic enzymes cause the cell damage or necrosis of the cell death. So it includes phase of clearance. So whatever the inflammatory mediators or inflammatory cells are there, they will release certain proteolytic enzymes. And these proteolytic enzymes causes clearance of this necrotic tissue. And then phase of ingrowth of granulation tissue. First step is inflammation. Second step is clearance and then of dead tissues. And next, formation of ingrowth of granulation tissue. It mainly involves two steps. First is angiogenesis. Angio means new blood vessels. Genesis means production. That means formation of new blood vessels. It is also called as neovascularization. Neo means new. Vascularization means formation of new blood vessels. So formation of new blood vessels at the site of injury takes place by proliferation of endothelial cells from the margins of severe, like whatever the cells are there, this is a tissue damage. So it takes place by the proliferation of endothelial cells, endothelial lining which will be lining the blood vessels. When it undergoes proliferation, it forms new blood vessels. So what happened first? Initially, it will forms solid buds within a few hours, and then lumen start carrying blood. So starting, it only forms a small bud-like thing, and then slowly it develops. It forms a narrow lumen, and then once the lumen is formed, blood will flow. So the newly formed blood vessels are more leaky. Why? Because their layer is very thin. So that is the reason they will be very leaky, more leaky. So which leads to edematous appearance of new granulation tissue. As they are leaky, it causes edema kind of edematous appearance of the granulation tissue. And once this is formed, it will undergo differentiation and maturation, and then it will get converted into arterioles, thin walled veins or true capillaries. So first it will form some only small buds, and then lumen will be formed and starts flowing of blood, and then it undergoes maturation or differentiation, and then these will be differentiated into arterioles, venules and capillaries. So the process of this angiogenesis is stimulated with proteolytic destruction of the basement membrane. Only when there is destruction of this proteolytic destruction of the basement membrane, from then only these endothelial buds can be started. So it will take place by the proteolytic destruction of basement membranes. So what are the molecules or what are the proteins that will help in the formation of these new blood vessels? So first is vascular endothelial growth factor. So it is released by certain mesenchymal cells. What it also include connective tissue cells, fibroblasts. So all these what will they will cause? They will cause the production of these vascular endothelial growth factor, and also platelet derived growth factor, transforming growth factor beta to beta, TGF beta, and B fibroblast growth factor beta. So these are the growth factors which helps in the formation of new blood vessels and surface integrins. So all these molecules will helps in the production of or helps in the formation of new blood vessels. What are the vascular endothelial growth factor, fibroblast growth factor, platelet derived growth factor, and transforming growth factors. So these are the four kinds of factors which helps in the formation of new blood vessels, and these factors are released by or these are elaborated by mesenchymal cells. And so now new blood vessels are formed, and now this is the second step is fibrogenesis. So as I said that fibroblast growth factor, it helps in the formation of fibroblasts. So these fibroblasts originate from fibrocytes, that is fibrocytes, and also by mitotic division of fibroblasts. So this is how new fibroblasts are formed. So whatever the new fibroblasts are there, they'll undergo combination of they will be having the functions and morphological changes. They'll undergo and converts into myofibroblasts. So whatever the fibroblasts are there, they'll modify into myofibroblasts. Okay. So these collagen fibrils begin to appear by about 6th day of wound healing or repair of wounds. So and then as maturation proceeds, more and more collagen deposition takes place, and more number of blood vessels will be formed. So all this together will form the scar tissue known as cicatrization. That is nothing but initially in the first step new blood vessels are formed. In the second step fibrogenesis, that is fibroblasts are formed, and then collagen gets deposited. So slowly the amount of collagen deposition also increases, and then the newly formed blood vessels also increase, and fibroblasts all together forms a tissue like a scar, which is called as scar tissue or it is also called as scar tissue, and the process of this whole process is known as cicatrization. Okay. So these are the neovascularization. Whatever the red dots are there, that we consider as newly formed blood vessels. So these are the plasma cells, these are the macrophages, and these are the lymphocytes. So all these are the inflammatory mediators released. So once these are released, they will release certain proteolytic enzymes and causes the dissolution of this endothelium. And when this endothelium is opened, or when the basement membrane is damaged, and then what will happen, whatever the newly blood vessels are there, their production will be increased, and also these will activate the certain growth factors like vascular VEGF, PDGF, and all these growth factors will be released, which helps in the formation of further new blood vessels. And then these are the fibroblasts. So when these fibroblasts are released, this will be increased in number these will be produced from the fibrin cells, or due to fibrocytes, so our mitotic division. So when these fibroblasts they gets accumulated, they together will be converted into differentiate into myofibroblasts, and then this will be followed by collagen deposition, and all together forms a scar tissue. And the second step is contraction of wounds. Now scar tissue is formed. Now it has to be contracted so that it will mix up in the normal tissue. So the wound contraction starts after 2 to 3 days. So and this process will be completed by 14th day of wound. So during this process, what will happen, whatever the wound is there, it undergoes contraction. So because of that reason, it will be reduced in the size. Approximately 80%, it will reduce its size. So how does this will reduce its size? How does it undergoes contraction? So first is dehydration. So as I said that newly formed blood vessels are so leaky. So that is the reason they'll be having edematous appearance because of this exudation of fluid. So because by the means of dehydration, whatever the excess fluid that is deposited will be removed, and it will be undergoing drying will be takes place. So Well, because of this, almost all half of the size will be reduced because of this dehydration, and then contraction of collagen. So whatever the collagen deposition is there, it will be contracted, and then it also contains myofibroblasts. So these will undergo migration into the wound area, and their active concentration decreases the size of the defect. So when these myofibroblasts replace the normal damaged tissue, that also will decrease the size of the damaged tissue. So these are the steps that are involved in contraction of wounds. First is dehydration. So whatever the excess fluid is there, that will be removed. And the second is contraction of collagen. Because of this contraction also the size will be decreased. And because of this migration of myofibroblasts, it also decreases the size of the wound. So these are the steps that are involved in contraction of wounds. So as I said that fibroblasts will be converted into in the form like structure and functionally they'll make some changes and converts into myofibroblasts. So what could be the characteristics of these myofibroblasts? So the fibrils present in the cytoplasm of these cells resemble those in smooth muscle cell. So the fibrils, it will have the smooth muscle appearance and they contain actin myosin similar to non-striated muscle. So they'll be having the characteristics of non-striated muscle and smooth muscle cells. And the cytoplasm of these modified cells demonstrates immunofluorescent labeling with anti-smooth muscle antibodies, and also the nuclei of these will be having nuclear membrane as like in smooth muscle cells, and they have the basement membrane. So which is not seen in case of fibroblasts, but in case of myofibroblasts there will be basement membrane and desmosomes can be seen. And drug response of granulation tissue is similar to that of smooth muscle. So the response to this tissue, so it will be like the same as that of how it responds in case of smooth muscle. So these are the characteristics of myofibroblasts. So this is all about contraction of wounds and granulation tissue formation and repair. So repair involves two steps: granulation tissue formation and contraction of wounds. In granulation tissue formation, it will be on three phases. First is phase of inflammation. Second is phase of clearance. Third is phase of ingrowth of granulation tissue. And in this step, there will be two steps, that is angiogenesis or neovascularization. And the second is formation of fibroblasts, that is fibrogenesis. And these are the steps which are involved in the granulation tissue formation. And then the other step is contraction of wounds. It involves dehydration, contraction of collagen, and migration of myofibroblasts. So these are the steps that are involved in the repair of wounds. So as of now, this is all about wounds, repair of wounds. So thank you all.